Good day, guys. This is a video to update you on my visit to my gynecologist yesterday after I had a laparoscopy done just 2 weeks ago. I went yesterday to visit with her because after I had the surgery, I couldn't remember what she told me because I just woke up after the anesthetic and I felt really drowsy and I couldn't remember a thing she said. So yesterday I went and she told me that yes, we didn't she didn't remove the fibroid, which I already knew and remember. She told me that she didn't remove the fibroid. She didn't remove the fibroid because the laparoscopy we had done 2 weeks ago was to remove a polyp or a cyst, whatever she said she was supposed to do. And if she could remove the fibroid, she would remove it. That's what I said to you guys before, because she said she doesn't know if she cannot take it out. She won't take it out, but she wanted to take a chance to go and remove the polyp, and then if it's possible to remove the fibroid, she would. So she told me she couldn't remove it simply because the um, the tool that they used was too small to bring the fibroid out, because I didn't sign the consent for her to dilate my cervix and what else. So therefore she didn't do it. She wanted my consent. She wanted to know exactly what I wanted to do. So I told her that I really want to take the fibroid out. When I went yesterday, I was on my cycle day 3 and I was in so much pain like I have never been before when I have a period. Usually when I have a period, I'll have some cramping on the first day and maybe a little bit during the morning. But for the past 3 cycles, I've been having a lot and lot of crampings and, just painful cramping all throughout my cycle. For the 5 days, I'm in pain and I'm bleeding a lot. And she was pushing me, which I didn't like at all. It was not a really good visit yesterday, because I don't want a nurse, a doctor, a husband, or a child, or anybody to tell me really what to do. I don't like that at all. I'm very stubborn. So I have done my research. I know what I need to know that fibroids cause a lot of cramping and heavy bleeding. So that's what I want to do. I want to remove it, whether it's a myomectomy or it's laparoscopy. I want to have it removed. But she was so concerned. She wants me to do an embolization, where they will burn the lining of your uterus completely. Then I will never have a period, and I would never have another fibroid in my uterus. So the way I see it, it's actually wants to take the easy way out. So we burn it, whatever the problem I have that's causing me to bleed a lot and to have cramping. She wants to do it. She doesn't want to hear it anymore. She just wants to burn the lining of my uterus and scar it completely. Then I will have zero chance to ever get pregnant, and also to never have a period. It will cause a premature menopause. I am 42 years old. I will be 43 next month. And I don't think it's a good idea, because not only to conceive, if I cannot conceive, I've been saying that so many times, God blessed me abundantly with 2 wonderful little guys, and I'm happy with that. If I cannot have another child, I will not die. I will be heartbroken, but I will be happy with my 2 kids. But I don't want to have a premature menopause when I start having problem with hormonal problems, and they would have to put me on supplements like estrogen pills or patches. I don't want to do that because it causes a lot of problem when you are on hormone supplements, and I do not want to do that. So I said to her, I do not want to do that. She seemed to believe that I don't want to do that because I still want to have a child. Yes, I do. But she's saying, you seem to think that if we do that, you're not gonna even be able to get pregnant. But if we do a laparoscopy or if we do a myomectomy, you still not gonna be able to get pregnant because the fibroid is not the reason why I'm not getting pregnant. That's what she's been saying. I told her, let's not talk about having a child. This is not what I'm here for. I'm here to have the fibroid removed in the less invasive way possible, and also I don't want to cause problem for later on. So she agrees she wants to do that, but because I've been telling her that I've been having some heavy bleeding and some crampings. So she wants to do an IUD. I have never done it before, and I want to take it one day at a time. I don't want to do 2 3 times, because that's what she said to me. She said, I don't want you to go in the OR again. This is going to be my second time. She said, I don't want you to go there a third time under anesthetic. If you want to control the bleeding, you want to control the crampings, then you have to do something to stop it, because she said the fibroid is not causing me this kind of problem. But everywhere I read, everybody I heard who had fibroids, that's one of the symptoms when you have fibroids. You have heavy bleedings and you have some discomfort and all that, but she said that is not the reason why I have it. So I asked her, because of all this pain, could it be endometriosis? Because endometriosis can cause you a lot of cramping, because when the lining of your uterus starts to build, it grows everywhere when you have endometriosis. That's what it is. For people who don't have endometriosis, the lining of your uterus just stays on your uterus. But with people with endometriosis, the lining grows everywhere, in your reproductive organs. And she said, well, there's no way to find out except if we go and have a different kind of procedure to look inside of my uterus to see that. And I said, oh my God, I was there 2 weeks ago. Why didn't you do that? Well, I didn't say that, but that's what I was saying in my head. I was pulling my hair off. And she said it's a different kind of procedure we have to do to look for that. And she said, what we can do, she wants to put me on medication just in case if I have endometriosis. For God's sake, I don't even know if I have it, but you want to treat me with medication for something you don't even know if I have it. I want to find out if I have it, and then we can start with medication or something to help me out. So I said, well, what if I don't have it and we're treating it? So she said, well, with all the pain you're having, then you will stop having the pain. Well, the thing is, if you're having pain and they give you something that will cause the pain to subside, then you're going to believe that, yes, I have endometriosis. I just want to see it, to believe it, to understand it. So she saw that I was not a happy camper, because that's the way I am. I am very, very transparent. Anything that's happening, I'm not going to hide it. I'm going to tell you, that I'm not very happy with it. So what we are going to do, I signed up for to have the surgery early January to remove the fibroid. But there are risks with the removal of a fibroid. Everybody knows it, and I know it. And she was telling me all the risks. One of the biggest risks there is with this procedure they're gonna do is where they're gonna put me under anesthetic, and then they will open me up just like when you go for a pap test or anything like that, and then they will insert the speculum to open the vagina, and then they're gonna put it something with a camera to go inside, and they can cut with the other instruments, and they will also put some fluid inside of the vagina so they can see. So the fluid is not water, and she said the only problem with that is it's about 500 milligrams. She said they will put monitors on me to control it, because what happens when they put the fluid inside of you, so where the camera is going, and the little instrument to cut around the fibroid, what happened when they do that, your body starts to absorb the fluid that they put inside. And sometimes it happens, not very often, but it happens where you start having your brain start to swell, your lungs start to swell. But she said to me, because there will be people there, nurses there, especially by my side, to check that, they will control how much liquid they put in and how much is coming out, because anytime they put it in, they will be watching how much is coming out. So they say sometimes they can be off by two mils, and it's just enough. If they see the amount they are putting it in is not coming out, then they will stop the procedure, because they don't want your body to absorb too much of that fluid, and then to start causing you major problem with your brain, with your lungs. So they will stop. She said they will stop as soon as they see they are missing 2 to 3 or 5, I think it's 2 to 3 milliliters of that fluid, because they don't want my body to retain it. So this is my biggest problem. I'm thinking, oh my God, the risks are way worse than the actual problem, maybe. So I don't want to have a brain aneurysm. I don't want to have a problem where I cannot breathe and all that. So I'm thinking, oh my God, what do I do? What do I do? So I did sign the consent, and they sent it to the hospital, and I will be waiting to hear from the hospital for an appointment to go have the surgery early January. I'm going away for a week, all by myself, myself, and I, for the first time in years. So I'm so happy. I just need that before surgery, just to relax and be with some friends and enjoy my time. So that is my update, ladies. I am terrified. I am just terrified. I don't like going under anesthetic. I don't like going into an operating room. I don't like that at all. But I've been waiting for this for a long time, and I don't want to back down. I just want it done, and I'm praying, and I'm asking you guys to keep me in your prayers, so everything will go smoothly. And whatever happens, happens. I've been through a lot with these fibroids, and if she can remove them, that'll be fine. And when she wrote down all the problem that I can get with this removal of this fibroid, it's enough to say, okay, I can live with the fibroids, because she's talking about, what can happen. I can puncture your bowel, I can puncture your bladder, I can puncture your uterus, then you'll have to have an hysteroscopy. And I said, oh my God, oh my God, oh my God. Yes, I'm happy that she's telling me all that, but at the same time, it's enough to say, okay, I'm done. I can handle heavy bleeding and cramps for 5 days in a month. But I told her, if I change my mind, I'll call the clinic and cancel the surgery. But, if any one of you guys have had anybody who had it, please let me know. And if you are dealing with fibroids just like me, hang in there. It's hard to deal with this all the time, and I've been telling some people that I know that when you have fibroids, it's almost like when you're pregnant. You have something that is inside of your uterus that plays with your hormones. I'm not blaming my weight on it, but it is so hard, I found, to lose weight. And I never had that problem at all. I could lose 40 pounds in 3 months. I have done it many times, but I've been dealing with a little bit of weight for the past, I don't know, a year and a half or 2 years. I cannot get it off, and I'm so happy. I just got off 10 pounds over the past couple of weeks. I don't know if it's stress, I don't know what it is, but I have lost 10 pounds, and I want to keep going. I want to lose at least another 20 pounds. But when you have fibroids, it's hard on your body. It's mentally draining me, especially because I would like to have another baby, and this is staying on my way. But you know, I am trying the best that I can to make it better, and hopefully the doctor will agree and do what she said she's going to do, and hopefully there will be no complications. I will go to have the surgery and come back the same day and have no problem at all. So again, guys, thank you very much for your prayers. You've been so nice to me, and I don't know what I do to deserve this, because I've been making these videos for the past at least 2 years. I don't edit videos. I just come here, sit and talk, and you guys watch. You like my videos, you comment, you pray for me, and I really, really appreciate that. I'm just putting my experience out there, my story. I'm putting it out there because who knows how many people are dealing with the same problem as me. Maybe one thing I say could help. So thank you again for watching, and my new subscribers, thank you so much, and have a great weekend. Bye.